Hi, and welcome to week 7. So matrices for interior composite restorations are typically mylar strips. They can be clear, they can be blue tinted as in this picture, but ultimately we can see through them, and that also allows the curing light to penetrate through and properly cure the resin. There are also compound supported metal matrices that can be used for class 4 composites. I haven't ever personally used this type of system, but I have seen it. Some people really like this, so it is an option out there. A matrix is not necessary for a class 5 restoration because the contour can be controlled as the composite is being inserted. And then also for both the mylar strips and the compound supported metal matrix, wooden wedges are usually used to hold these strips into place. Placing a class 3 composite. Number 1, we're going to place the matrix and wedge. This is typically that clear mylar strip and a wooden wedge. Ensure you select the correct size wedge so that it is properly sealing off the tooth. And make sure the mylar strip is long enough to be folded over during that curing process. Next, we're going to etch for 15 to 30 seconds depending on what etching method you are using. We're then going to rinse it dry, and then we will prime and bond. Make sure you're following the manufacturer's instructions while you are priming and bonding. And then if you are using a universal etch, prime, and bond adhesive, steps 2 and 3 could be combined for this process. For step 4, you're going to add your composite in layers. Make sure that small increments are placed and they are compacted very well. For very small class 3s, flowable composites can sometimes be used in very small increments as well. For step 5, you want to make sure that the matrix strip is held closed without movement while the composite is being cured with the curing light. The picture that is shown towards the bottom with that glove shows that mylar strip is folded over during that curing process. This allows the light to penetrate through, but also allows the strip to kind of control the shape and aesthetics of the filling. And then lastly, you're going to check contours to ensure that the restoration is not under contoured. Take your Explorer and make sure it's not dipping down after it's cured. You want to make sure it even has a little bit of extra bulk material, that way you can polish it down. It's easier to start with excess material than it is to start with not enough. And then once completed, finishing and polishing will take place, but we're going to learn all that next week, so we're not worrying about that step quite yet. There are some videos for this week as well in Blackboard under your materials and resources folder. Please be sure to check those out. This one on class 3 placement, very helpful. There's lots of others as well. So next we'll talk about a class 5 composite. Very similar, a little bit different. So again, ensure proper isolation. You can place cord and hemostatic solution if necessary, if the gums are bleeding there. It also helps to push the gums away a little bit for better visibility. So keep that in mind. Usually no matrix system is used though for a class 5. You'll want to then etch for 15 to 30 seconds depending on what method you're using, and then prime, bond, and cure. If you are using a universal system, it has etch, prime, and bond all in one step. Then for a caries related class 5, I'd recommend using packable composite in 2mm increments, just because it's a little bit stronger. But for abrasion related class 5s, you can use flowable composite. And then last, check contours to ensure that the restoration is not under contoured. If it is, you can add more material at this time. Please watch this video in the materials and resources folder. Same with this video, please watch it. And this one as well. Thank you. Once the filling's placed, we obviously want our patients to feel comfortable, so minimizing patient sensitivity is huge. Make sure that you follow manufacturer's directions for all products being used. Make sure that you're using the correct size of increments of composite that they recommend, curing for the correct amount of time, making sure the etch sits as long as it needs to, but not too long that it's making the tooth more sensitive. Check into how long the bond needs scrubbed for. Use a timer if needed. Provide good isolation and moisture control as well. You don't want the filling to be contaminated with any blood or saliva. This can cause sensitivity. You can use a liner and or a desensitizer as well to help minimize sensitivity, and then also ensure that your occlusion is accurate on the filling. Inaccurate occlusion can cause sensitivity because the filling is getting stressed from all the forces placed upon it. So making sure that you have perfect occlusion, the patient isn't hitting too soon or too hard on the filling, is going to help minimize patient sensitivity. So how do we evaluate if our filling was a failure or if it was successful? Failure happens for a few different reasons. Too sensitivity, that just doesn't go away. It's not getting better when biting or chewing. A lot of the times it's from biting into hard things or biting hot or cold, even sugary or acidic foods. It can be caused by improper bonding. So your bonding was not adequate enough to hold the filling in place. Improper isolation, so blood or saliva seeped in while you're placing the filling. If the occlusion is too high as well, if you didn't cure the product long enough, or even if you're very aggressive with your finishing procedures and the tooth gets too much heat received. Another way that things can fail is if it's the improper shape or anatomy, and it therefore causes more bacteria to attract to the tooth. So anytime the surfaces are rough, more bacteria is going to go there. If there's food traps, obviously that food is just going to sit there. If you're not flossing properly, it's going to eventually cause both periodontal disease and also recurrent decay. And then lastly, if there's visible blood or debris from improper isolation. This should never be the case. If we are seeing visible blood, that filling needs redone. So please never let a patient walk out of the office if there is visible blood in a filling that you just placed. The doctor should obviously be checking for that, but if you notice it, please don't just try to get away with it because you're running out of time. This patient is going to have big issues because of that contamination.